welcome everyone. I'm Carolina Serrate, and I'm the president of the New York Council of Child and Adolescent Psychiatry. I'm absolutely thrilled tonight. We have the luxury of spending the next hour with Dr. Clarice Kestenbaum, and we're dedicating this hour to celebrating a lifetime of work that she's done. She has positively impacted the lives of many little ones and their families through direct care, but also through the training of numerous generations of child and adolescent psychiatrists, contributions to the field, and just by simply being a phenomenal human being. Tonight's celebration would have not been possible without the work, the creativity, Dr. Scott Palio and Dr. Olga Leibu, who have been working with Dr. Kestenbaum on a terrific project that will be shared with you guys tonight, and we'll have the privilege of having access to it as a premiere. College and a psychoanalytic candidate at NYU postdoctoral program in psychotherapy and psychoanalysis. With an ACAP, many of you know that Scott serves as the co-chair of the PAC board and BILAS committees, and within our ROCAP, he chairs the membership committee. Dr. Olga Leibu is a diplomat of the Board of Psychiatry and Neurology in both child and adolescent and adult divisions. She's also a psychodynamic therapist and completed her training at Columbia. She holds leadership roles as assistant clinical professor at Icahn School of Medicine at Mount Sinai, and she sits on the board of the New York Council on Child and Adolescent Psychiatry as co-chair of the Early Career Psychiatry Committee. She currently sees child practice and she teaches residents and fellows. And tonight, Dr. Leibu will be our moderator. So with that, I'll pass on the baton to Olga.
Hi, everybody. We are so excited to be here tonight and have all of you join us. I do want to give a little background about the woman of the evening. Dr. Clarice Kestenbaum. She's a professor emerita of clinical psychiatry at Columbia University. She's also the past president of the American Academy of Child and Adolescent Psychiatry and the American Academy of Psychoanalysis and Dynamic Psychiatry. A recipient of numerous awards for her leadership and service, she focuses on child development, psychopathology, and children at risk for schizophrenia and bipolar disorder. She's also the co-founder of Caring at Columbia, an organization that helps at-risk children through the arts. For over 65 years, Dr. Kestenbaum has been a leading clinician in the field of child and adolescent psychiatry, remaining active into her 90s. Dr. Kestenbaum teaches and supervises in psychodynamic therapy and continues to work with children and families. I am honored to have the opportunity to interview you today. I wanted to share first the program that we have been working on, Scott, I, and you and your son, called The Words of Wisdom with Dr. K. This is a program that will allow everyone to have access to the treasure that you provide. And in this series, you share stories from your life, your lectures on child development and psychotherapy. You lead clinical consultations with CAPs and trainees and demonstrate how to engage children in interviews. By the way, you do all of this through telemedicine, showing your never-ending ability to stay current, creative, and impactful in the field of medicine. Please follow Dr. Kestenbaum's program on Facebook and Instagram, and of course, watch our first episode on YouTube and leave questions and comments, which Dr. K may actually respond to in a future episode. Today, Clarice, we're filming during the ACAP annual meeting as part of the launch party for this series with a segment focused on women in medicine. We're looking forward to learning from your experiences and how to navigate the challenges that having such a role may entail. Clarice, presently there are millions of women in the workforce, but they are still not breaking the glass ceiling. According to the American College of Physicians, when it comes to leadership roles, only 38% of women hold faculty positions in medical schools. In terms of compensation, females are paid 16% less than their male counterparts in primary care and 37% less in subspecialties. The pandemic has only exacerbated the disparities, and women psychiatrists are struggling to figure out how to take care of patients and their own families, and actually have started to leave the workforce. There was a recent article in Clinical Psychiatry News on January 2021 indicating that. So keeping this in mind, Clarice, my first question to you is, can you tell us what it was like being a woman when you started in medicine and as your career continued?
Well, it was very difficult, I'll tell you, because there was such prejudice against women going into medicine. Now, I was very fortunate that I had my training in Israel. I had graduated with a BA from UCLA in English, in music, and literature, even had a science course. But I was a Zionist and was very happy to be in Israel, go to Israel. And there, it was so easy. They accepted me right away. The courses were all in every language. It was French, German, Polish, from all the refugees who had just come over as 53 from everywhere to Israel. And so, but the books were all in English, and most of the professors hardly spoke Hebrew. So I didn't have a hard time there. But what was amazing was that there were 25 women in my class of 50. And these were very tough women. They had been in the army. Some had been in the Warsaw Ghetto. They had been unbelievable in terms of their life experiences, and they were really tough. And they were absolutely equal with the men, very tough, very solid. We had a lot of fun. I had a wonderful time in medical school because in Israel, as in Europe, it was a 6-year course. So I was able to do the pre-med that I had never done. 53, I lived there 53 to 58 or 9, and I was happy. And they were so wonderful in terms of letting us do everything. I felt absolute equality. However, I decided to come back to get my degree. I wanted to have an American degree. I wanted to go back to UCLA, where I had Phi Beta Kappa, I had all of my credentials. And, I was turned down by, when I tried to get back, I was turned down 37 times when I wanted to come back, by letters or individuals who said, well, you're taking the job of a man because you're only going to get pregnant and leave us. The only 2 places that took me, one was the medical evangelist California school, because they were so happy to have a Jewish girl who had been in the Holy Land. They figured that would be enough credential for me. And UCLA finally, I just papered the walls with the rejection slip. But then when I went to UCLA, I was shocked. The difference, it was 5 women and 55 men, and the men were horrible to us. It was very, very difficult. If you be assertive, you were called aggressive, or they were constantly humiliating, but they would make us examine patients, male patients, in front of the whole class. Where is the inguinal canal? Please show us. Being the only girl, let's say, in that particular group or class, just to humiliate and make sure that we were absolutely not equal. But I was very strong. I was very persistent. I knew I was going to be a psychiatrist, even though I had a rotating internship and did everything at the VA hospital before I came to New York. But I was determined to fight this, because when I got to New York and the residency, there was still bias and prejudice. This was in 1961. I was the only woman in the class of 12, let's say. We know you're going to leave us, get pregnant, take the job away from a man who has a family. There was a huge amount of miscegenation and difficulty then. I remember that was a long time ago. Now, as you pointed out, Olga, there are so many women in our profession. 55% psychiatrists are women, but they get less salary than men. They don't have positions of great authority in terms of grants, in terms of being heads of departments, professorships, etc. There still is a glass ceiling. It's better now, but there is still this discrepancy and this difference.
Thanks for sharing the experience, how different it was actually at the same time. And when you were in Israel and then coming here to the US, shocking, the difference. Can you speak about when you taught medical students and residents, what did you share with your women mentees about being a woman in medicine, especially if they wondered, how do you balance it all? What does their life look like when they're married, when they have children, etc.?
I think so many of the women here in this audience, as some of you know, because I gave lectures on this really for 50 years. I wrote a couple of articles on the professional woman's dilemma, love and or power. Can you have both? And I gave the examples of Venus, the goddess of love and beauty and sensuality, and power, Minerva, who sprang from her father, Jupiter's brain, never married, never had apparently a relationship of any kind, but was brilliant and very powerful. And then Hera, the wife of Jupiter, who didn't do anything on her own, but was the woman behind the man and really was the most important figure because she kept track of her husband. She was extremely confident as the woman behind the man and not in her own right. I started running women's groups, and sharing with women some of the difficulties. And then even in one of the articles that I wrote, I had 5 rules that the women had to have. And the first rule was to choose your partner with great care. Let's say you're on the dance floor at a party given at the hospital or whatever, and a nice young man dances with you and says, "Oh, you're a medical student." Well, of course, you're not going to practice when you get married. I mean, this is nice to have. I said, simply run. Don't walk to the nearest exit. Do not look back. Don't even think of accepting a date again with that guy. And it was very funny because it was a rule with so many of the women. And I had many women coming up to me and said they met a very nice guy, but he said he wouldn't allow me to work. What, is she a slave? She's a piece of property, that we know about from history. Oh, you couldn't work after that. And I said, I don't even want to hear about it. Just leave. That's not the person for you. So the third rule was, beside love and intimacy, there has to be a real companionship. 2 psychiatrists, it's a little hard sometimes, but for somebody to be in another field like emergency medicine or something else or law or whatever, but to be a professional woman in medicine and have a husband who respects your work. And that's very, very important to have that partnership and that respect for one another, because medical school is very hard. Then let's say they have a family. I always recommend to medical students, you try to wait till you finish, the STEPS exams and the shelf exams. And when you finish these things, it's so hard in medical school to have a family. But I've had women who had already had children or had 2 or 3 while they were medical students. And that is very difficult. For that, you have to have somebody amazing around, your mother, grandmother, or aunt, somebody who's really going to be there. Because to be a medical student, to be in residency is hard enough. It's not that bad in the child fellowship to be able to have a child. You're already so far advanced and you know so much. Your partner, remember, the partner doesn't have to be a woman and a man. It could be 2 women, 2 mothers, because many of the cases that we see now are women together, or 2 men who have either adopted or actually had a child themselves through a surrogate and brought them home. So when I talk about mother, I'm talking about the mothering figure and the father figure, because it used to be just male, female, but it's not that way at all anymore. And it's very important to recognize. Now, what does this mean? Let's say that it's the usual father, mother. Never. I mean, I've lived a long time. I mean, I think I'm the oldest person ever to have a series on YouTube, but never have I seen 50-50 with the partner, with men and women, never. You're lucky, I say to these women, if it's going to be 70-30, maybe 60-40, more like you're never going to get 50-50. You're just not. One has to compromise, one has to realize that. I would say the last 10 years is better, and there can be more or less 50-50. But I remember my mother, a great feminist, in the early days, it must have been in the 30s, she wanted my dad, who was a very hardworking physician, to help in the house. She believed so much in equality, and she was a professional woman herself. She taught, which is very good if you happen to have a parent, a mother, who is a professional, because there's your role model. And she wanted my dad to be 50-50 with her. So he'd be exhausted after delivering babies or coming home at night. And she'd say, okay, you can do the dishes. So she would hand him a dish and a towel. And guess what? It would fall on the floor and break. And then she'd hand him another towel and a dish, and it would break. And whether that was passive aggressive, or whether that was aggressive, or whether that was just exhaustion, but she gave up on that long before, didn't expect. And because in those days, the husbands and the partners didn't do that much. They're so much better now because people are used to it. And the third rule was compromise. A woman who has this life, and you can do it, has to make many compromises. So the third rule was be sure to have a really good nanny. Now, with nanny, that means could be a grandmother, an aunt, it could be hired. Au pair, not so good because they leave every year, but you have somebody who is there. That used to be on the farm. There'd be an aunt, a grandmother, somebody who's doing that. We don't have that anymore. People are too separate, but you have to have the best possible help. And I did. I believe very much in having every nickel that I spent, honestly, was making sure I had good help, because we didn't have, my husband and I didn't have parents who were right there. They visit, but they weren't there. So we had to have help, and they have to be good. Now, here's an example that some of the women had this problem with the nanny. It happened with me that I was working very hard every day, and the nanny was there taking care of the housekeeper of the children. One night, my son fell out of a crib, had to rush him outside our hospital, and he was 10 months old. He was very active. He clung to the nanny and didn't want to even see me. We went to Mount Sinai together. We got an x-ray, everything was okay. But I was deeply hurt. I had this sharp knife-like feeling in the heart. My son loves the nanny and doesn't love me. I told a woman friend of mine, she says, "Oh, fire the nanny." Well, I was so smart. Never fire the nanny who loves your child and his child loves him. They'll learn later. Try to spend a little more time, but don't take away a beloved object because of your own envy and jealousy. You learn who is there in your family and who is, somebody that you pay, that you have to, because you can't have somebody you can't trust.
Clarice, thank you so much. On the topic of the nanny, what kind of advice do you have about speaking with your children about nanny and their role, especially if they do love their nanny, right? But the nanny is not necessarily, the nanny can leave, the nanny can get sick, right? What do you do in that?
They love the nanny, but they know that the nanny is somebody with her own life, with her own family, her own children, that she loves you and you love her, but she has another life too that's not in our family. And you make it very clear the difference in sister, brother, uncle, and somebody who is a very dear friend, but not living there and has their own life, because they will leave at some point. But it's very important to explain that and have that role. And children usually do understand that and keep up with the nanny who comes maybe once in a while to babysit, or they send cards, or they visit. But I want to get back to another point, the working mother. I wanted a big career. I didn't just want a job and a work, but most women have to work because they need the money. The family needs 2 incomes, or even 3 now. I wanted a career, and I knew I wanted to be a psychiatrist, and I knew I wanted to work with children. So I worked at home, and it didn't matter that they saw the children once in a while. I had nannies there for them, but sometimes the children would run out, would come in to the room, but something would happen. It's just grist for the mill. It was fine. I never really had a problem with that, but I would have a sign on the door, "Mommy working," because that's my office. And they would know that when they could come and not come. And one of the things, though, that was very important that I would tell all the young women, you must have that word, quality time. It's a very, very important and good concept. My quality time is this: 7 to 9, that was my time. That's when I could come home. No patients unless they're jumping off the George Washington Bridge. No interruption by phone call with, a friend or somebody, which a lot of women will pick up their phone. No, put the phone away. Don't get called unless it's emergency. And that 2 hours you do, whether it's reading to the children or the child, or whether it's just playing the game with them, or singing songs, or doing music, or the bedtime ritual. But I did it every night, 7 to 9, with one child and then a second child. And it worked very, very well. I would try very hard to leave in the middle of the night if I had to go out of town for one day to give a lecture, be visiting somebody at some professor at some place. But I was very careful to always then phone and know. The kids never thought I was away that much because they saw me all the time. I would take them on trips. For example, I had to teach them certain things. I'm at Georgia. I'm giving a lecture, and it was a psychoanalytic meeting. So all my professors were there. And I said, now I want you kids not to act up. And, they'd fight like any kids, tussle, fool around. They're very active kids and very noisy. Anyway, I'm walking down the hall and the kids are wild. They're running, they're acting up. They're really, one is 8, one is 5, and they're being very silly and funny. And I said, mommy's professors are here. Both of you pretend to be nice. So they did pretend to be nice while we passed my professors. And that was something that they used, a little mantra, pretend to be nice was always very good. So, there's a lot of things. I could bring the kids on the trips. I could be with them. At the same time, that special time, I did a lot of things, but always that special 2 hours was very important. You always write on the calendar when you're going to be away or when daddy is away, or one of the partners away, and they call in if they can, but they have to know physically when the parent is there and when not, both parents, and when they can call, or what if somebody's in the army and they really can't call? You have to know that, talk about it, but always have the presence of the other person there so that they can get object constancy. The chaos in the lives that we see now, which is terrible with the pandemic, is because they don't know who's going to be there. Are they going to be in school? Is it virtual? It's very, very tough, and especially now. But if you can have any kind of regulation. Now, the last thing, Olga, that I want to mention is that the woman has to really be able to compromise, because there's always things that happen. You always have to, healthy children, of course, it's easy to handle. If you happen to have a child with a problem, some of the women have to take time off for a year, whatever, to work with their child, whatever it is, because it's very, very important. But there is a problem with women who have a baby and fall in love with their baby. They love the baby so much, they don't want to go back to work. I can't work. I love my baby and I don't want to go to work. And I would just yell at them. I mean, at my own students, I would insist that you have to open an office 1 day a week, or share with a friend 1 day a week. You spend all this time in medical school and you're going to give it up. You can love your baby, but the baby will, go to school, and high school, college, and you'll be very sorry if you don't do this. Just last week, I got a call from a former resident who thanked me and said she didn't want to open the office. And I just insisted, I was very tough. You have to have 1 day. And then it got to 2 days, and then pretty soon more. And then she said, I have 3 children. The last one just now went to college. And I realized that I have my work, and I'm so thankful because I love my work and I love my children very much. But if I had given it up, I would be very, very sad. So
I think you had one more example maybe of a social worker.
I wanted a career. Not every woman wants a career. So I had one social worker at St. Luke's years and years ago, and she had a baby. And she and her husband with this baby went to Australia. She loved that baby so much, she wouldn't get dressed all day. She and the baby were, united at the hip. And then when the baby was 2, she had another one. And when that one was 2, she had another one. And she so loved having babies that she never went back to her profession and wanted to have, I don't know what she did when she had the 5th baby and she was older, maybe just take care of animals. I don't know what she did in Australia, but you can't I can't impose my wish on somebody just because I wanted a career and I wanted to do this. Doesn't mean that every other one did, but I think once one has gone through medical school and then residency and then child fellowship, to give it up, to me, is just crazy. To do that. So I only have one person in all the history who actually chose not to have their profession.
Can you share, just so you spoke about, the situation where the child falls in love with the nanny, but what about the situation where your children may have some jealousy for the patients that you're seeing, the other children?
There's so many cases like that. So one child psychiatrist found her daughter, who was 7, wearing the fur coat of a patient who had just come in Scarsdale and was sitting in the waiting room. The mother said to her, "What are you doing?" Because the child is in the waiting room. And she said, "I'm pretending to be a patient," because that mother was not doing quality time. And that child, they will get jealous of the patient, but the patients get jealous of the children. And when you live in a small town, everybody knows everybody and everything. So you see them on the street, you see them in the supermarket, you see them everywhere. And New York is like a small town too. If you're living in Brooklyn or you're living in Upper West Side, you run into everybody. It's all grist for the mill. It's something that they have to learn with sibling rivalry, and they have to learn it with rivalry for their friends. And you have to let them know there's enough love and room in the world for everybody. I must have a lot of patients who say, "I know I'm your favorite." And I'm happy that they think that, because everybody at the moment is a favorite. Oh, I have another rule for the mothers. Don't do everything. You don't have to be the cleanest housekeeper, the best cook. You don't have to bring the cake to the birthday party of all the children. You do have to go to their performances, everyone, whatever they're in, their graduation, when they're presenting, they're speaking, you have to, whatever you're doing, both parents have to do this when they're important, when it's their day.
This is so exciting. And thanks so much for sharing, about your life and how you managed it. I think you're teaching so much how to be parents and have a career. The last question that I have for you before we'll open it up to the audience is, how do you maintain so much energy and motivation to continue work with so much passion into your 90s?
I think that's genetic. You have to have a certain enthusiasm, love of life, and passion, or you can't do this. You could go into another field, maybe public health, where you don't have to see people or work with them. I mean, I tell a lot of the students, some of them are extremely talented. They're just a natural. They know what to do with children. They know how to play. And others who really are not. They're very, very good at their numbers and other work. And I say, you can find the cure for schizophrenia, go into research, don't see people. But sometimes it works, sometimes it doesn't. But I think, you have to have a love of what you do, or you can't do it. Freud knew this. People have their own energy level, their own creativity, so much of this is inborn. And you sort of have to know yourself. If that's not who you are, you do something else. Incidentally, what do women want? Nobody knows. Nobody's ever figured it out. Nobody knows what human beings really want. And then the question is, can one have it all? And I say, yes, you can have it all, but not all at the same time.
Well, thank you so much, Clarice. I think I am very excited, and I'll speak for the audience. We have a big audience. I think we're all very excited. And, I do want to open the floor up to questions from the audience. Any questions that you may have for Clarice, or any comments, that would be great.
Clarice, what was it like filming for your YouTube video at 93?
It was so much fun. First of all, I have to thank so much the Academy, the Council for having this project, but especially Scott and Olga, who absolutely had this idea. I run a class, it was every 2 weeks, now it's about every 3 or 4 weeks, of my former students. And many people come, even though they're 60 or 70 years old, we still have people that love this class, because we all learn as peer supervision. We learn from each other so much. There's people that learn forensics, or people who learn medication, or people who learn psychoanalysis or public health. It's a wonderful way of sharing ideas. And I'm hoping that people will take a look, because what it is my lectures over many, many years, plus the teaching, because we're going to have how to work with a child of 5, one of 11, through Zoom, which is hard for people, to know, along with case examples from the group. It's a wonderful group to be able to have and share these ideas. So we've been doing that for 20 years. And it's a little hard in the pandemic, but not so bad because everybody's in this generation is used to Zoom or, WebEx or FaceTime. And some people find it, the children find it very easy, much more than their parents. They're so acceptable. They love this. They love the games. They know video. They don't have a hard time. Some of the parents have a hard time with this. Some of the doctors have the worst time. They feel so self-conscious. Yeah, so it really is fun. It was a lot of fun for me.
I think, Olga, your questions were just fabulous. And I think when you ask Clarice about how did she do so much, where did she get the energy? And she's always had it, always had more energy than anyone. We would divvy out tasks sometimes in whatever the project was, and everybody would complain. The next morning, Clarice had completed all of the tasks. And she just has this passion that comes through in everything. And she mentioned the last thing she talked about was fun. I think fun drives Clarice a lot. She has rejuvenated from it, and she's the first one to be there with a lot of fun. And when she was the Hanukkah fairy every year and had her protest party of sorts, and she just is phenomenal.
It's just so nice to see you and to see everybody here. All of these people are obviously so grateful to you for everything that you've done for them. I know that I am. And I've also had a chance to see, get a sneak preview of the video. And so anybody who hasn't seen it yet, it is amazing. It's just so beautiful and moving. And I love the pictures of you when you were young. You were like such a babe, I have to say. Yeah, so it's just really nice to see you.
She's still a babe.
Yeah, pardon me, but you are even more babe like that.
Hi, Clarice, it's Owen. And everyone's been talking about Clarice's work with students, but as a young faculty person who first worked with Clarice and then not so young faculty person, I have to say that throughout my entire professional life working with Clarice, I was always learning from her. And Clarice, maybe you want to say something about mentoring junior faculty and not so junior faculty, because I think, one of the central things about Columbia was that we always could learn and you were always available for teaching.
I could never have done this without Ian Canino, and I mean that very seriously. When I came on as training director, he was there. He'd been there about 5 years. He was the most unbelievable partner, support, help to me. I could not have done what I did. I have a lot of energy, but he was like the frame. I have a lot of wild energy that goes everywhere. He was a frame that would put it together in a way that made it very, very easy for me, whether it was writing the grant, which believe me, he did 99% of, or starting caring, which he did with me, and to be a great, great teacher that I learned an enormous amount. I don't want to embarrass you, Ian, but I could not have done what I did, honest to God. I could not have without I had a wonderful assistant, a secretary then, that was Helen Richer. She died a few years ago, but who was a wonderful help to me for those years. But Ian, as I really could not have done what I did. All of you have been enormously, helpful and wonderful, but you don't see, in this case, it was the man behind the woman, because he was the one who literally carried me through a million experiences. That was something that really helped tremendously.
Clarice, it's Jerry Young.
Jerry, hi.
Hi. So I'm one of Clarice's students from the very earliest years, the late 20s, I believe it was, I wanted to ask you about families currently in a different way, which is the role of the father has changed in ways that are very, very good and very important. But what would you say about how the role of the father has lost something that might be detrimental to the family?
Well, the role of the father is very, very important. And it doesn't mean if it's a home father who's taking care of the children, one who's working. I still believe in the Oedipus complex very much, because if you work with one children, you see it, you see the importance of it. The role of the father is, look, the triad, the third person. It doesn't matter the gender of the person, it's the child with the mothering figure and the child. And then at 2.5, there's another person there. So it's a triad. And then come the siblings and the teacher and the other people. It's very, very important. I don't think the gender matters so much as the idea of the triad, being able to, triangulate, to be able to have another person come in and break the very important bond with the mothering figure and child. If the roles can be defined, though, I believe very strongly in family therapy, more than I ever did, in generational. That's the parents bring in the grandparent or the extended family, at least to have sessions together, which I do, and it's wonderful because you get to see the whole family in several generations and the differences in the generations, especially if some comes from another country and where there's different mores. And so that is very, very important.
Clarice, thank you so much. We have 3 minutes left, so I just wanted to be mindful of the time.
Just to pick up on what you were saying at the end, Clarice, it's something that you have talked about from the very beginning that I always valued. You and I both trained as child analysts, but the involvement of the parents from the beginning, you encouraged, and we really appreciated it. What I call teaching the teachers. And that was one of the things that I took from you, and your encouragement that it was okay, so to speak, was very helpful.
Thank you so much.
I just want to briefly say, Clarice, I really honor you and the role you've had in my life, and that when I did the psychotherapy class with you and Paulina, that I brought my cases from the South Bronx, and that you've always been a support for me working in the margins and bringing your expertise and wisdom to those populations. So it's been an honor to have you in my life.
Thank you so much. Yeah, thank you very much, everybody.
Hi, Clarice. It's Heidi 40. How are you?
Heidi, it's so good. And thank you. You sent a beautiful basket of wonderful goodies that just came an hour ago. Thank you. The rest of the
So you are so welcome. And I just want to say on behalf of the Academy, how much we all absolutely love you and just feel so honored to know you. You've added so much to this organization. And for me personally, you've been such an important person as part of ACAP for pretty much as long as I can remember. So thank you. Thank you for everything.
Thank you.
I just wanted to wrap up the event. First and foremost, thanking Clarice for spending this hour with her NICAP family and ACAP family, sharing her definitely pearls of wisdom and very kindly and warmly just keeping it real. I think this was amazing for every person, whether you identify as a woman or not, in this Zoom tonight, to hear a very real, well-informed and thoughtful perspective of what it means to have it all as a woman in child and adolescent psychiatry. Thank you to all of you who joined us. We are very grateful that you came together to celebrate Clarice, and we really look forward to comments and maybe also supporting the project that Olga and Scott have been working with Clarice. Feel very proud to be part of this NICAP family, New York representing, and just looking forward to continuing to see some of you in some of the events in the future, and enjoy the rest of the meeting.
Thank you so much.
Thanks.
A great pleasure and great honor for me. Thank you.